SEC tip of the month. Today we're going to speak a little bit about lateral ankle instability, and we're going to demonstrate a very important ankle exercise to do both pre-injury in order to try to avoid injuries as well as post-injury, especially if you're suffering from chronic lateral ankle instability. When you roll over on your ankle, there's two real barriers that you have to pass through before you can sprain the ankle or sprain the anterior tibiofibular ligament. The first barrier that you go through is actually the fibularis longus and brevis muscle. So in order to actually sprain your ankle, you're going to have to impart some damage onto these muscles before you can get through the second barrier, which is the actual ATFL itself. Now, the fibularis longus and brevis is located on the side of the leg. It's coming from the fibular head, and it's going inferiorly. The brevis is attaching into the base of the fifth metatarsal, whereas the longus is attaching underneath the foot on the first cuneiform and the base of the first metatarsal. So what these muscles do when they contract properly is they prevent lateral ankle movement. So they prevent people from rolling over on their ankle. When they contract, it keeps you facing directly forward. So when you have a lateral ankle instability, it's important to properly rehab that muscle to prevent this from happening again. So the exercise that we're going to do today involves a quarter, and then later on it will involve a piece of TheraBand. So we're going to first start with the quarter exercise. So first I want to demonstrate what a weak fibularis longus and brevis would be. So you find this in someone who has chronic lateral ankle instability. So if I get her to come up onto her toes, and you notice a lot of lateral movement of the feet, so she's coming up on the lateral hinges of the foot, go up again. That's one of the ways to tell me that she does not have a sufficient lateral ankle stability. So for the exercise, I'm going to turn around and face this way. We're going to simply take a quarter, and we're going to get the patient to put the first metatarsal phalangeal joint directly on the quarter, and then she can stabilize herself with her other hand. And what the exercise will be, we're going to ask the patient to do simple calf raises, but the intent here is to drive the quarter through the ground. Go ahead. So what we're trying to do here is we're trying to promote that the foot does not collapse over. So we have to activate the fibularis longus and brevis muscle in order to maintain that proper alignment. So all of the force is going right down to the first metatarsal phalangeal. So that would be the first stage rehab. In order to make this a little bit more difficult, we would take a piece of TheraBand. We're going to get the patient to put the foot in the exact same position. This time we're going to add a little bit of lateral force to the foot. So we're going to simulate a little bit more force coming down on the foot, and we're going to get that fibularis muscle to resist the lateral motion. Once again, she's driving the quarter right through the ground, the first metatarsal phalangeal joint. Good. Now, this kind of exercise would obviously be combined with a lot of proprioceptive rehabilitation in order to stimulate the nervous system and make the reconnection between the foot and the cortex in order that we don't keep rolling the ankle over again. So you should add this movement to any post-lateral ankle instability problems.